the Associate Dean for the Regional Campus of Medical College of Georgia at Augusta University, and I've been rehearsing that for weeks to get all that out all at once. In a former life, I was Chief Medical Officer here at the Health System for about 10 years, and at that time was able to be a part of the development of this regional campus for Medical College of Georgia. It was actually the deciding factor in a series of conversations that led me to leave private practice of general surgery in Cordele, Georgia, and take on this job. In between the PV job and my current job, I worked for the Georgia Hospital Association, where I came to know a bunch of you from working around the state with quality and safety initiatives. And as soon as I got to NCG, I got asked, do you have an interest in rural health? Rural hospitals and things like that? I said, of course I do. So I was asked to be able to, I was given the opportunity to participate in President Keel's initiative to set up this Augusta University Center for Rural Health Support and Study, which we want to try and make sure that what we're doing is not replicating what others are doing, but we want to make sure that we're getting people together and giving you the opportunity to learn from each other, but also to help us know what's missing. What is it that we can do for the rural health networks, for the rural health systems, for rural health providers that can help you find a way forward through these really troubled times. What's today? November the 1st, but what happens today?
Open enrollment. Open enrollment.
Open enrollment, yeah. I thought somebody was going to say All Saints Day. Everybody say All Saints Day. So open enrollment begins today, and there's a lot of uncertainty even around how that's going to work for one more year. And some of that is now sitting in the courts to determine whether or not the subsidies are going to be paid or not paid and things like that. So there's a lot of uncertainty not only for you, but for the people you serve. How many of you have seen an increased enrollment in insurance in your small communities as a result of the exchanges? We have a few? Yeah. We have some who've seen that. And that's obviously it's very different from state to state. Again, this is one of the reasons why we have people not only from here in Georgia, but from out of the state here today to talk with us. So these are some pretty challenging times. Before we get into introducing our first speaker and setting the tone for the day, though, I want to introduce Joel Warnick and have him come up and just welcome us, if you would, Joel. Joel's the CEO of PV Health System. I got to know Joel when I was in practice in Cordele because PV Health System was one of those who recognized the value of keeping rural providers in the region healthy. And so we started off early that way and made it easy for me to go to work for you.
Thank you, Doug. Welcome, everybody. You were in the original Albany High School, and we acquired this property when it was turned into surplus. We moved all of our learning activities across the street because it used to be in a congested area. And quite frankly, we bought it for the gymnasium. And if you get a chance, take a tour of our employee wellness facility, which has been a great opportunity for us. But perhaps what's most important about what happens in this building is our collaboration with Augusta University and the University of Georgia. As we all know, I think one of the single greatest predictor of success in rural hospitals is an adequate supply of physicians. And so we have a great partnership that's now 10 years old as the first satellite campus of the Medical College of Georgia. And we have third and fourth year students. And less than a week ago, we had 200 MCG students sitting in this room looking at our campus, and our goal is to continue to help stoke supply physicians for rural southwest Georgia, not necessarily Albany. We also have a family medicine residency that works in concert, and it had a goal of having 60% of the residents remain within 60 miles. We're actually at about 70% within 70 miles. So those kind of strategies are important, but what's even more important is the collaboration we have with folks that we couldn't do it any other time ourselves. And I think one of the opportunities we have today is to learn from each other about some of the challenges of rural activities. And the last thing I will tell you is you're actually at the largest rural hospital in Georgia. When a hospital closes 25 to 30 miles away to the west of us, where do the citizens of that county go for their care? They end up at Beaver Butte. And so when you look at our patient base, over 50% really comes from a rural zip code. And so many of the things that confront a large tertiary center, in our case, actually are the issues of rural hospitals. And we're also blessed to have an opportunity to work with Americus, Sylvester, and Cuthbert, all who are rural communities that have different challenges in this space. And of course, we enjoy our partnership with the greater rural Southwest Georgia also. So probably more than you wanted me to say, but just to give you some context, and for those of y'all who aren't from Southwest Georgia, just know it's where thousands live and millions wish they could.
Thank you, Joel. So as we start getting ready to head into this day, and we're going to kind of span the spectrum, if you will, of small hospital and health system experts who come from far away and those who are here very close by, and sharing lots of great stories, hopefully, about things that have worked and maybe some things that haven't worked. When we think about the uncertainty of the future, we think about different competitive threats and who's in our marketplace and who's doing what. And as hospitals and health systems or physician practices, we tend to think of other hospitals, other health systems, other physician practices as our primary competitors. That may not be our greatest competitive threat. Anybody heard any conversation recently about CVS? How many of you have a CVS close to your facility, anywhere in your small community? Who is CVS in merger talks with now? With Aetna. How big will the CVS-Aetna merger be? $200 billion. Yeah, from a market cap perspective, 5 times bigger than HCA. From a revenue perspective, 4 to 5 times bigger than HCA. And we think about HCA as a massive healthcare entity, and that they certainly provide lots of great care all across the nation. But CVS is in places where HCA is not. CVS is in places where other health systems and hospitals are not. And what kind of services are they expanding into? Some of them are the kind of things that we've depended upon in hospitals, health systems, and physician practices for revenue. So they're either our greatest threat, or they may wind up having to be a necessary partner. And so these are the sorts of conversations that as we go through the next few hours, but certainly over the next weeks and months, you as leaders in hospitals and health systems, particularly in these vulnerable rural areas, are going to have to be looking at things differently than we've looked at them in the past, in terms of who we're going to work with, who is actually going to support our mission, who has the potential to destroy our ability to survive.